decision to start Rhino Health was that point. During the pandemic, I took part in developing an AI algorithm that could predict if patients would end up needing mechanical ventilation and how well they would do. And I wanted to share that algorithm with multiple medical institutions, but it seemed that the ability to do so was hampered by the concerns about whether the model would generalize, whether it would work in other places, and whether you'd have some sort of a common platform to run it on. And I decided to tap into federated learning with the support of an industry partner, NVIDIA, in order to make that happen. And we saw that you could retrain, validate, and then prepare for deployment an algorithm created in one institution in 20 others very quickly, the second you alleviated the need to share data. And that's a federated learning technology. I thought to myself, after the pilot was really catching wind, this is something that's not just a software library. It needs to actually become a commercially hardened platform that you could use for all sorts of similar efforts and beyond. And I told my NVIDIA counterpart, you guys should really evolve this kind of like fairly rudimentary technology into something much more robust. And what I heard as well, we don't typically do these kind of things, but maybe you should. And I thought, maybe I will. And that was the kind of a starting point of starting Rhino Health. The House of God was an excellent read. It's a depressing read. It's very realistic in some ways, and it's surrealistic in other ways, but the gist of it is actually most similar to how a hospital run, for better or worse, mainly for worse. It's cautionary because it talks a lot about how an institution is run for the provision of healthcare rather than for treating patients. And while the story itself has a tendency for surrealism, a lot of the concepts are really not as dissimilar for stuff you could see as a young intern and then resident in a hospital. I try to give my son a dessert at the end of the day, which is often an ice cream cone, and I often end up eating more than him and sometimes taking an extra. I guess I like a good pistachio, I like good double chocolate, I like good vanilla.